In a related development, the Nigerian Association of Resident Doctors has threatened to embark on strike if the abducted colleague, Dr. Ganiyat, is not released by August 26. The president of the Association of Resident Doctors, Fanin Dogo, made this declaration at the Federal Medical Center, Makodi, the Benue State capital, stating that the association has lost patience with the government's inaction over the abduction. Ganiyat, a registrar in the Department of Ophthalmology at National Eye Center, Kaduna, was abducted on 27th of December 2023, along with her husband and nephew. While her husband was released in March, Mrs. Ganiyat and her nephew remain in captivity.
Our colleague, Dr. Ganiyat Popola, my doctor with the National Eye Care Center, was kidnapped, like I said earlier, 7 months and about 20 days ago. The kidnappers came to our house in the evening, took her and her husband and the nephew, little boy, took them away. Frantic efforts have been made to see their release, and I understand that humongous amounts of monies have been paid over this period. Eventually they released the husband, but Dr. Popola herself and the nephew are still with the kidnappers. We understand that she's alive. We've been having some form of communication with her, and that is the only thing that gladdens her heart, that she's not harmed yet. And we are hoping by the grace of God that within the shortest possible time she'll be released hale and hearty. And like we said earlier, if she's not, we may have no other option but to take other routes. And that may be by shutting down completely. I
can only imagine what she's going through. Dr. Ganiyat is a mother, she's a wife, she's a doctor. She has been through this and nothing has been done about it. We are here to cry to the public. We are crying to the government to please, they should please help us and release Dr. Ganiyat.
And also in Kaduna State, Dr. Ganiyat's Popola colleagues have called for unconditional release, threatening to down tools if she's not released soon. Details in this report.
Doctors and other health professionals in Kaduna unite in a peaceful march. They are calling for the immediate release of their colleague, Dr. Ganiyat Popola, who has been held captive by unknown gunmen for 8 months. The breastfeeding mother was taken from the doctor's quarters of the National Eye Care Center in Kaduna after gunmen broke into the hospital's perimeter fence. The protesting health workers say her abduction has not only shaken the medical community, but also highlighted the growing insecurity that professionals face daily.
Today is a sad day in the history of National Eye Center and Nigeria as a whole, because Dr. Ganiyat Popola was kidnapped from the staff quarters of National Eye Center on the 27th of December 2023. So by 27th of August 2024, that would be exactly 8 months that she was taken away from us. So we have tried everything possible within legal means, within the resources available to us. We have notified everybody that needs to be notified. 8 months is a long time. That is why a lot of medical personnel in particular are leaving the country in droves. So those who have chosen to stay behind deserve to live in safety in order to serve the public.
During the march, they voiced their concerns and fears about the increasing insecurity affecting their profession. They cautioned that if Dr. Ganiyat is not released soon, they may have to resort to downing tools, which will further strain the already overburdened healthcare system.
As stated yesterday during the press conference, if Dr. Popola is not released unconditionally, the association cannot guarantee any industrial harmony.
This was a breastfeeding mother that was separated from her baby. So we may be forced to down tools, not just from this center, but all over the country, and not just only NAD. I'm sure MD can, that's the consultants, the senior groups may be forced to join too, but we don't pray it gets to that, but if our hands are tied, why not?
Their message remains clear. Without urgent actions, both to secure their colleagues' release and address the rising tide of insecurity, Nigeria risks losing more of its essential healthcare workers. Lupe Asom, TVC News, Kaduna.